to health, and the Ghana Health Service is saying that it is working on ensuring that proper screening is carried out at Ghana's point of entry to detect the deadly coronavirus. In the interim, the service wants the public to be conscious about the disease. This follows the recording of the first suspected case in Ivory Coast. Now, the virus broke out in Wuhan, China, before spreading to other parts of the world. And the Deputy Director of Public Health, Dr. Franklin Asedu-Bekwing, has been given more education on the subject. He spoke to Koji Yankson and Mamavi Owusu Abaji on the AM show.
What we want the public to know is that we have this outbreak that started from China. The outbreak can be detected at source. That's when you're entering the country, or can be detected in country. The person who may be having the disease or the virus may spread it. Hello?
Yes, we're listening. We're listening. Please go ahead.
They may spread it when they sneeze or when they cough. So, in order to prevent a neighbor from getting it, when you are sneezing or coughing, make sure that you are covering your nose and mouth with tissue or handkerchief. We are also saying that in order to prevent people from getting infected, the person who is sneezing or coughing must be washing his hands with soap and running water. In that case, you do not have the viruses around you. The other aspect is somebody who is, let's say, without the virus, must make sure that they protect themselves from a neighbor. So that's the way the discussion is going. So there's one side, one person who has the virus, who's supposed to ensure that it does not transmit the virus to the other side. And this other person who must keep himself a bit distant. So that is the way we are hoping that we all go in that perspective.
Okay. Now, God forbid, but if we
let me also add that we are saying that typically the presentation is the fever, cough, and difficulty in breathing. And we are saying that when you have such a condition, please report to the nearest health facility as early as possible for management.
Very well. God forbid, but if we do, register any cases of the novel coronavirus here in Ghana, will the treatment be covered by the NHIS?
Now, public health emergencies, when they are declared, the costs are not borne by the patient. It's borne by the government.
Very well.
Dr. Bekwing, I have a question on this possible first African case in Ivory Coast. What do we know about it?
I just spoke to my colleague and said it's being investigated, so I don't have the full details. I just spoke to my colleague, so I think that we'll wait to make sure we get the full details of it.
So, right now we're concentrating on persons coming from particularly China. With a possible, this Ivory Coast lady who is being tested, are there plans between Ghana and Ivory Coast, the border, for instance? What is there an exact plan?
Yes, so we do cross-border meetings, and we also have the point of entries that are coordinated. So what we've done is that if you look at our case definition that we issued out, the health facilities and the point of entries, and quite a number of the point of entries have this thermal scanners. So as you walk through it, your temperature is more than 37.5. You have a fever, so you'll be detected at the point of source. So what I'm saying is that there are two approaches about detection. It's about detection at the point of entry, and also as you get into the country, which in that case will need to be done at the health facility. But we are trying to make sure that this message permeates further down, so that the detection will be enhanced. And I think that is what we are pushing. And we are happy about this dialogue. It's going to help the discourse, so that more Ghanaians are sensitized, whether you're a clinician, whether you're a general public person.